I'm Sara Faggin. I'm an Italian vet, and I deal with pets, cats and dogs. In the past, I treated also cows, and was a job I loved a lot, but now I'm only pets. And I'm an expert in behavioral problems like fear, aggressiveness, phobias and traumas, psychological traumas, and I really love my job. I'm also a physician and homeopath, of course, so this is my job. I was searching for a sort of kind therapy for my patients, especially cats, because cats don't want to be treated with medication because they have a problem with taste of drugs. And when I try to help them for psychological problems, I needed some kind of natural or kindly medicine, and because we can use pharmacological drugs, but I wasn't so agreed to use them. And I discovered first Bach flowers in my path, and after homeopathy. And there was a colleague of mine, a vet, that introduced me to homeopathy, and I wasn't so impressed the first time. But then when I discovered the potentiality of this medicine, I felt in love. And for me, this is homeopathy. I deliver my visit in home of my clients, and so especially as an expert of behavioral problems. And sometimes I go to their home, and sometimes in the office. Yeah, so I use both. Okay, sometimes I use only homeopathy, and sometimes I need to use both. It depends on the situations, it depends on the problems or conditions my patients show, and so it depends. If I can, of course, I try to use only homeopathy, but I have a lot of clients, owners, and so a lot of pet condition to treat. And often owners are not aware about what is homeopathy, so it's difficult to give homeopathy as only a single therapy, so I need to gain the trust of the owners first, and then I can have a deep path of treatment with my patient and owner, because I have to deal with not only with animals but with owners and the relationship they have together. So I try to treat in a complex way, in a systemic way. It's not simple to answer this question. In an ideal world, I'd like to use only homeopathy, but I know that there are situations, there are conditions that ask me to work together with both medicine. What is important to me is not to forget that my aim is to treat in a whole way, and not forget that what I see in my patients have some how can I say, some motivations. Okay, it's not only a condition that I have to treat, not only symptoms, but a more wide situation, more wide, and there are a lot of causes. This is important. And then if I use one or both medicine, in my opinion, is not so important. It's important the way I use them. There are, in my opinion, two effects. There's no a placebo effect. It is impossible, because really they don't have the awareness that they are taking a medication, but they are influenced by the owner's thought. And so could be not a placebo effect of homeopathy, but an help by the thought and the feeling of the owner. So we should differentiate this kind of effect. But when we think about a placebo effect, when I use homeopathy in animals, I can see a lot of psychological aggravation or mental aggravation. And in my experience, my opinion, this means that there's no placebo effect, because they feel the action of the medication, the remedy. So they are really, really fast to show this effect, especially cats. They are so sensitive. So this is why they need small doses and a really gentle therapy. I'm dealing with a really, in my opinion, complex case. I have a patient, a dog with cancer. A really severe cancer is an hemangiosarcoma cancer. I don't know if in English is the same, but more or less, hemangiosarcoma is a cancer of vessels, blood vessels, and is a female dog, and she has the cancer in her thigh and in the back, and it's really, really painful because this cancer grows and cause pain. And I was able to find a sort of balance using homeopathy and using a little bit of conventional medicine, some cortisone medication, to let and to allow her to live a good quality of life. And I'm really, really happy, and the owners too. And she was really sensitive to painkiller drugs, so she couldn't take painkiller. So with homeopathy, we found a balance, and so I'm really happy. And she's still alive because it's a really severe cancer. And I saw her 3 days ago, and she was really happy, really nice. And when I saw her the first time, she was really painful, really with a lot of tension, because she was really in a discomfort situation, and I'm really happy, really. No more, I think probably little pain, but not so strong to cause a discomfort. Probably cortisone gives more discomfort because has a lot of side effects, but we need a little dose weekly. We don't use cortisone daily, but weekly, and in this way we are managed a really severe case. And so I don't remember a lot of research. I read them. I don't remember a lot, but we have papers that talk about the effect of homeopathy in animals. And I have a lot of appreciate, for example, a research in which a Brazilian team studied the use of Antimonium crudum in cells and dogs with Leishmania. Leishmania is a really spread condition, an infection by a parasite, and is really spread in the world. And I have used this research to help my treatment, and I had good results. So we have studies, and without placebo effect, of course. Yes, I have to explain that I have two kinds of owners. Owners that ask me to treat their pet with homeopathy, and they are the best because they are aware about what I mean when I can talk to them about aggravation effects or waiting time before giving other dose. So it's it's not simply, but it's more simply to treat with them, and they accept all kind of homeopathic remedies, and they are it's really interesting working with them, because they help me to understand better how homeopathy works in animals, because they report me the effect or the side effect or the good effect. They are fundamental for my job. And in the other hand, there are owners that don't know anything about homeopathy. I try to give them animal only one remedy if I think that is really useful for animal, but I don't like to propose them to use homeopathy to treat the whole or the case, because I think that I don't want to, I'm sorry for the word, to waste time and energy with people that don't understand the real power of homeopathy, and I prefer to separate. But if I think the animals need an homeopathic remedy, I give and they accept. Yes, I don't have trouble also with owners, but also with my colleagues, because I've never discredited by them, because I use a really conventional language with my colleagues and with owners. So I'm accepting as a homeopath also by my colleagues. I used to send them a clinical report about my visit, also my visit on behavioral trouble or problems, but also on homeopathy, and using a conventional language. And they accept, and often they ask to me what I think about some cases. So I have a relationship with a lot of colleagues, because yes, I'm a well-known vet in my country, yes. They turn to the clinic for the same condition or for other condition. They don't ask for homeopathy because they are not so aware about the power of homeopathy. They accept, and they say, this is enough to me. And I try to concentrate and to focus my attention on owners that are more aware. Yes, the challenge is in my daily practice is to understand what the animal I have in front of me needs, and what are their feelings, what are their pain, because it's really difficult to understand, because owner talked to me about, he has this, but I need to really I need to know what the animal needs. This is the challenge, not only in homeopathy, of course, in my daily practice, but when I use homeopathy, I need to understand the core and the sufferance of the animals, and this is not simple. And I have to use often my intuition, okay, and my sense. So we call sixth sense, of course. Yes, and this is a challenge. Interesting challenge. Really, no. Probably because in one case, I had a doctor, and my colleague proposed an homeopathic treatment. He isn't an homeopath, but he studied a little bit homeopathy. And of course, she was a conventional doctor, and she was shocked by our prescription. And I said to her that I wasn't disposed to waste my time to explain to her why homeopathy is important. And this is why I don't find skepticism because I try to avoid discussion with people that don't know homeopathy. And I say to them, if you don't know homeopathy, if you didn't study homeopathy, we can't discuss because you are not aware. And I try to explain you something that I have learned in a lot of years. So this is why it's a sort of skip. I suggest to learn homeopathy first, okay? Not to read book for animals, but to read book about homeopathy in general, because homeopathy is one. And then to go deeper in animals, but it requires a lot of years to be understood, especially for animals. And first I suggest to learn about animal behavior. This is really important because it's, I think, a key. We use a lot of physical symptoms, of course, but we need to know the real way how animals show emotions and mental state. So this is my suggestion. And in Italy we have an association, the International Association for Homeopathy. So, and we are a lot of vets involved in this association, also doctors and a lot of sanitary professional, and so they can ask for. In a conventional way, we treat behavior problems with human medication, like psychopharmacological drugs. And with Bach, we try to treat also the relationship the animals create with owner and the owner create with animals. And this is important because more often the relationship and the environment is a main cause of emotional discomfort in animals. So, but sometimes we can't change the relationship and the environment. So in a conventional way, we use a lot of pharmacological drugs. And this is not a good way to help animals, but sometimes we need to act because people need to be helped in their daily routine. I prefer homeopathy, of course, but sometimes it's not allowed it because of the situation, of course. In my really personal thought, homeopathy has resisted until now. Homeopathy is, in my opinion, is a sort of universal law, okay, and is based on universal laws. So the future is green. It's a good future for homeopathy as a universal law, as a knowledge. The problem is homeopaths and community of homeopaths and how we will able to bring homeopathy in the future. This is the question, not for homeopathy. Homeopathy will be alive for the future and for decades because it's a real thing. It's and with homeopathy we can learn about the process of life, the process of materia, the process of substances. So it's not a science, it's a real fact. In my personal, I love homeopathy, of course, but in my personal opinion, we need and help as homeopaths to be able to bring homeopathy in the future. Probably we need to educate people more than we are done now, because they can understand about homeopathy and they can help us to use homeopathy better. And then we probably need to be more bonded, more unified from between us, because we need to act like a unit community Yes, but I'm not negative. I have a positive thought on homeopathy.